All right, guys, let's talk about how to assess our total body surface area burns. So there are a couple different ways we can assess the size of our burn. One, we can use the rule of nines, or we can use the London-Browder method or the Palmer method. Each of these methods has a specific way of calculating the TBSA, and they're all used just in different places within burn care. So usually we'll assess the TBSA initially on presentation, and then we'll assess it again maybe 24 hours to 72 hours later. And this is why, or the reason we do this is because a lot of times the burn tissue or tissue death is not complete until up to 72 hours later, or the wound may not be clearly defined up until that point. We only look at second and third degree burns, so partial thickness and full thickness burns. Superficial burns, remember, they don't count towards mortality, so they're not calculated into TBSA. You're not going to be hospitalized for a superficial burn. Think about sunburn. With the TBSA, we have to calculate it so that we know how much fluid resuscitation our client will need. So with the TBSA, if we use the rule of nines, our body is divided into portions of 9%. So it's most commonly used in adults. We can use it in children. It's probably the most common tool used. It's easy to remember, easy to memorize. It divides regions in approximately 9% or a fraction of 9%. We do use it, however, it may not be that accurate. So let's look at this figure. So if you notice the head, we have an anterior portion of the head and the posterior portion of the head. So the anterior portion is worth 4.5, so the face, and then the posterior portion of the head is worth 4.5. So the whole head is 9%. Also notice that his chest. So his chest is 9%, but then his abdomen is 9%. If we were to say his whole anterior trunk, we'd say 18%. Same with the backside. His upper back is 9% and his lower back, including the buttocks, is 9%. So his total posterior trunk is 18%. Also, we divide it anterior and posterior, but you can also divide it in half. So for example, we have his right leg. The anterior portion of the right leg is 9%, and the posterior portion is 9%. So the whole leg is 18%. So if you had a patient whose half of their leg was burned, so maybe the top half of their leg, anterior and posterior, was burned, that'd be 9%, because it's half of the front, half of the back, which is 4.5 plus 4.5, or half of a whole leg, that's 18, would be 9%. Also notice the groin is worth 1%. So let's watch this video about the rule of nines.
This is Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over the rule of nines for burns in an adult patient. And this video is part of an NCLEX series that I'm going to be covering over burns. And as always, don't forget to take the free quiz that will test you on how to calculate the rule of nines. So let's get started. What is the rule of nines? The rule of nines is a calculation used to calculate the total body surface area percentage of the body that is burned. And we use this calculation for adults. Now, why would we care about knowing the percentage of the total body surface area that's burned on the body? Well, for a couple reasons. Number one, does this patient meet criteria to go to a burn unit? Also, those first 24 hours after severe burns, the patient is at risk for hypovolemic shock. And what happens with severe burns is that it increases the capillary permeability. So what happens is that you have your fluid that's normally in your intravascular system, it's going to leave and go into the interstitial tissue. Well, what does that leave in the intravascular system for the heart to pump to your vital organs and tissues? Hardly anything at all. So the patient is at risk for death. And during those first 24 hours, we need to replace their fluids. And we take the total body surface percentage and we plug that into what's called a Parkland's burn formula, which we're going to talk about in the next video, and this will help us determine how much fluid replacement that patient needs during the next 24 hours. And the most common solution used to treat burns during the first 24 hours is lactated ringers. Now let's talk about how to calculate the rule of nines, and then I'm going to work a practice problem of something similar you will encounter on an exam. Okay, so whenever you're doing this, you want to keep some things in mind. You want to keep in mind the anterior part of the body, which is the front, and the posterior part of the body, which is the back. Because a lot of times people forget that, oh, it said the head and the neck, anterior and posterior, I need to add these two numbers together, so they leave that out and they get their calculation wrong. Now, each area is going to be divided into like the head and neck, the trunk, the arms, upper extremities, the perineum, and then the lower extremities, which are the legs. And each area is assigned a product of 9, which makes it a little bit easier to remember. So let's go over this. Okay, I like to start from head to toe. It makes it easier. We have the head and the neck. The front part of the head and neck, the anterior part, is 4.5%. That's how much that's worth. The back, the posterior part, is also 4.5%. And if you add those up together, say the patient had burns on the front of the head and the neck and the back of the head and the neck, that would equal a total of 9%. So head and neck. Then we're going to move down to the trunk. Okay, the anterior part of the trunk, the front, is worth 18%, and then the back of the trunk is worth 18%. So if you had burns on both the anterior and posterior part of the trunk, that would be 36%. Then we have our upper extremities, our right arm and our left arm. Okay, front of the right arm is worth 4.5%, front of the left arm is worth 4.5%. And that together would equal 9. So on the front over here, that would be 9% if you had the front of both arms burned. So we'll put anterior arms. Then we flip the patient over. If they have burns on their right back of the arm, it's 4.5%, and the back of their left arm, it's 4.5%. Add those together, you get 9. So 9% on that, that's the posterior arms. But when you add them together, say your patient had burns on both the front of the both arms and the back of both arms, that would equal a total of 18%. So see why I said remember that you have 2 of each and don't leave one out, because it's easy to do that. Then we move down to the front right here. That's a perineum. That is worth 1%. And then we have our lower extremities, or legs. And again, don't forget that you have 2 of those, and you have the posterior and the anterior. So the right leg is worth 9, the front, and the left leg is worth 9, the front. So you add that together, you get 18%. And then the back, the right leg is worth 9, the left leg is worth 9. So you get 18% again. That's the posterior part of the legs. And then when you add, if your patient had burns on both the front and the back of both legs, that would be 36%. So when you add 9 plus 36 plus 18 plus 1 plus 36, that gives you 100%. So now let's look at a practice problem. Our problem says a 35-year-old female has deep partial thickness burns on the front and back of both arms, anterior trunk, back of left leg, anterior and posterior sides of the right leg, posterior head and neck, and perineum. What is the total body surface area percentage that is burned? So now let's calculate. Okay, our patient has burns on the front and the back of both arms. So each arm in the front is each worth 4.5%, which would be a total of 9. And then we flip the patient back. Each arm again is worth 4.5%. That equals 9. 9 plus 9 equals 18%. Then it says anterior trunk, so that's the front, and the front is worth 18%. Then it says the back of the left leg, that is worth 9%. Then it says anterior and posterior right leg, so we're talking about the front and the back of the right leg. So the front of the right leg is worth 9, the back of the right leg is worth 9, so that equals 18%. Then it says the posterior part of the head and neck, so the back of the head and neck, and that is 4.5%. And then the perineum, it's 1%. So then all we do is add all that up, and what do we get? We get 68.5% is our total body surface area percentage that is burned on this patient. Okay, so that wraps up this review on how to calculate the rule of 9s for burns. Thank you so much for watching. Don't forget to take the free.
Okay. Let's go back. So you saw the rule of 9s, how to calculate it. Remember, it's the most common, easy to remember. So just know, you guys, you will need to memorize this. So here's our rule of 9s. We talked about the adult. Notice on the child, there's a couple differences. So their head is worth almost double that of an adult, or it is double. So an adult whole head anterior posterior is 9. A child anterior posterior is 18. So think about a child's head in relation to their body. Usually they have big wobbly heads compared to their little body. Also notice the legs. The legs are only worth 7 anterior and 7 posterior, so 14% total when compared to an adult who's 18%. So again, memorize this, know it, commit it to memory. This is our London-Browder chart. So it is more precise, and you can see that it breaks things down by age, and then also breaks different anatomical regions out more specifically. But again, if you notice, we only calculate 2nd and 3rd degree, so partial thickness and full thickness burns. They'll use the London-Browder more with children, just because their ratios vary with age. We still use it with adults too. Most burn centers will use the London-Browder. So initially we'll calculate a TBSA, and then 24 to 72 hours later, we'll recalculate it again to see if it's expanded so they have more burn depth. Sometimes they will, especially if we don't adequately fluid or resuscitate them. The other method is the Palmer method. So you take the palm, the whole palm, the hand, or palm and the finger, so the whole hand is worth 1%. They call it the Palmer method, but it's the whole hand. And whose hand is it? Is it yours or the client's? So think about in relation to the burn. It would be the client's. So I don't want to use my hand on a 1-year-old because their hand is in proportion with their body. My hand is way too big, so I would underestimate those burns. The Palmer method is good for scattered burns. So burns that you can't count, like a whole half a leg or a whole arm, you can use the Palmer method. So 1%. Another way you could do it is just use the palm, and that's a 0.5%. But remember, it's the patient's hand/palm. So let's do some examples. So our first example, we have a 78-year-old male comes into the ED with full thickness burns to the entire face, anterior chest, the anterior right and left upper extremities. Using the rule of nines, let's calculate the TBSA burned. Okay, let me pull up the whiteboard. So we have the face, his anterior chest. I'm going to put an A for anterior. And then the anterior right and left upper extremities. So anterior right upper extremity and the anterior left upper extremity. Okay, so the face, so just the anterior part of the head, is worth 4.5%. You may want to go back to your rule of nines slide right now. The anterior chest, so not the trunk, just the chest, that's worth 9%. And then the anterior right upper extremity, so just the front portion, is worth 4.5. And same for the left side. So add that up. It's going to be 22.5%. So almost a quarter of the patient's body has been burned. Okay. Our next example, we have a 4-year-old female client arrives to the ED with deep partial thickness burns to the head, the neck, the anterior trunk, and the right upper arm. So it kind of sounds like maybe they were reaching for something and dumped it on them. So maybe reaching for a boiling pot of water or something off the stove. So using the London Browder, let's calculate our TBSA burned. So let's go back some slides. Go back to our London Browder. So we have a 4-year-old. So we're in this section right here. So our 4-year-old has deep partial thickness burns. So those count towards our TBSA because they're deeper than superficial. Burns to the head, so 17, the neck, 2, the anterior trunk, 13, and the right upper arm, which is 4. So add those together and you get 36%. So that patient has 36% of their body burned, so over a third. Okay. There's our answers. So let's talk about real quick who gets transferred to the burn center. So with the burn centers, they have those specialized, special trained doctors and nurses that are used to dealing with burns. They're used to dealing with burns of any age, so children all the way up to geriatrics and anything in between. So those patients who have partial thickness burns greater than 10%. So with the 10% rule, remember, it has to be deeper than superficial. So partial thickness, either superficial partial thickness or deep partial thickness or full thickness burns will go to the burn center. Remember, we're not going to calculate superficial burns in with our TBSA because they don't contribute to mortality. Any burns that involve the face, the hands, the feet, the genitalia, perineum, or major joints, because they're going to need extensive rehab. Any third-degree burns, so any full thickness in any age group, they're going to need skin grafts, they're going to need a lot of rehab, a lot of physical therapy, occupational speech. Any electrical burns, including lightning injuries, chemical burns, inhalation injury, burn injury with patients with pre-existing medical disorders that would complicate management. So think about, we talked about the geriatric patient with CHF. The big treatment with burns, especially in that first emergent phase, is IV fluids. So if they have CHF and we're giving them IV fluids, we may exacerbate their CHF. Any patients with burns who have concomitant trauma, so maybe fractures, maybe spinal fractures, bones. Any children in hospitals that aren't qualified to take care of children. So a child that's been burned that's not used to taking care of pediatric clients, you can send them to a burn center. Or any burn injury patients who will require special social, emotional, or rehabilitative intervention. So a lot of these burn patients have psychiatric or mental health disorders underlying. They may be schizophrenic and they tried to light themselves on fire to calm the voices. That really happened. Also think about the trauma. Usually when fires happen, it's usually a traumatic event, one, because of the pain, two, maybe they lost somebody in the fire, maybe they have survivor's guilt because they're the only one that survived. With all these lists of who would be transferred to a burn center, you can almost think of it as anybody with a serious burn. And that's the reason for it. The burn center wants these patients. They know how to take care of these patients. They know all the evidence-based practices. So send these patients to burn centers. When in doubt, call and see. Tell them you have a burn patient. Can they be transferred there? They'll let you know. Most of the time, if they have beds, they're willing to accept these patients, even if their TBSA may be less than 10%. But this is your quick, hard rule until you call the burn center. Okay, so we have talked about how to calculate TBSA. In the next lecture, we're going to talk more about the systemic and localized responses to burn injury. We'll also talk about the different phases. So right now, if you guys want to take a break, take a 5 or 10 minute break, come back, we'll keep going.